Will Obamacare fix a failing healthcare system? Two doctors with very different opinions are going to weigh in. Welcome to Politicking. I'm Larry King. We start today with two doctors with very different views on the President's Affordable Care Act. In New York, Dr. Richard Amerling, he's president-elect of the Association of American Physicians and Surgeons, a practicing nephrologist. In Washington, Dr. George S. Benjamin, executive director of the American Public Health Association. He's an internist and emergency room doctor, and he supports Obamacare. We thank you both for coming. Dr. Amerling, an overview, and briefly if you can, what's the rub? What do you have against this concept, since up until Obamacare, I think we were the only industrialized nation in the world without a health care plan for its citizens?
Well, we have a fractured and disjointed health care plan that is heavily government financed at this point. Almost 50% are on some sort of government financed health care as of right now, before Obamacare. And then we have this crazy private system where individuals purchase health insurance through their employer. And that, of course, is a real problem because it limits the choice and it makes the payment a benefit in lieu of salary and gives you an incentive to spend. So we have this massive third-party system. In reality, very few people are without some sort of health insurance, and that rationale for taking over this entire part of the economy was never a good one. There were just like a relatively small number of people who had trouble getting insurance because of pre-existing conditions, and they could have been handled much more simply and more economically than the current program.
Dr. Benjamin, where is Dr. Amerling wrong?
Well, we have 50 million people who don't have health insurance. That's a lot of people. We also know that about 44,000 people die each and every year simply because they don't have health insurance. And I can tell you, when I was practicing emergency medicine, the first question anyone ever asked was, what kind of insurance do you have? So the Affordable Care Act tried to build on our existing system and has provided minimal disruption. Even though we're having some challenges, compared to what could have happened, this is really minimal disruption.
Dr. Amerling, how do you respond?
Well, the 50 million figure was a fiction that was composed largely of people that were between jobs and didn't have insurance transiently for part of the year and who eventually got insurance. And it also included illegal aliens and people who were young and healthy and invincible and who felt that buying insurance was a bad deal for them. So there's perhaps 10 million, 12 million hardcore uninsured who could have been handled much more economically. And the Affordable Care Act doesn't really address the people. In fact, it's putting people off of their insurance. It's throwing people out of their insurance program. They had perfectly good insurance that they were happy with, that they bought themselves, or next year you'll see that the employer-sponsored health insurance is also going to get decimated, that these are private contracts that individuals have with insurance companies that were arbitrarily dismissed by the federal government. I find that that's outrageous.
Dr. Benjamin, you will admit it's off to a rocky start. Do you expect to see a big change?
Well, you know, anytime you do something this big, it's going to have some bumps in the road. But this is a good program. It's a good plan. I can tell you that 50 million is the right figure. There are many, many people in that number. But I can just tell you, anybody practicing medicine today, anyone doing public health today, can tell you that the fact that there's no such thing as a hardcore group of people uninsured. It can happen to anyone. And if you have a heart attack during that period when you're not insured, it's a catastrophic event for you. And all the other nations of the world, all the other industrial nations of the world don't have this problem. We're the only one left.
Dr. Amerling, you said, I'm quoting you, there are compelling reasons for patients to opt out of Obamacare, Medicaid, and even Medicare. Explain. And how would you respond to the fact that
Sure.
we lack so far behind other countries in providing health for all of our citizens?
Well, I don't think that we do. I think everybody, more or less, with a very few exceptions, get health care. And the issue is health insurance or Obamacare or some sort of a card, like a Medicaid card, doesn't guarantee you access to health care. It just says you've got this card, and then the conditions apply. How are things actually going to get paid for? and who is going to be participating in the plans. For example, if you have Medicaid, you're not going to see very many private physicians in New York, I can tell you that. So Medicaid is horrible insurance, yet that is a big part of what Obama wants to do. He wants to expand Medicaid and put more and more people onto it. So there are studies out there that suggest that you're better off without any insurance than to have Medicaid. You'll have shorter intervals to get care, get to see a doctor. And look, the real problem here is that we have a system of prepaid health care. It is not truly health insurance. They pay for every little thing, which is absurd, and that's why it's become so expensive. We should have a system of perhaps universal catastrophic health care coverage, and then everybody pays for their routine care out of pocket. Then we would have a rational system, true insurance when you really need it, and then individuals assume responsibility for routine expenses. This would drive costs down. This would stimulate free market changes in the healthcare system with doctors and hospitals and other providers competing for healthcare dollars. And it would open up the system to true competition. And this is what this is the system that we had before the third-party system dominated, which began with employer-sponsored healthcare.
Dr. Benjamin, how would you respond to that? That seems pretty sensible.
Yeah, well, that system, we had lots of people who died. We had lots of disparities in health care. Medicaid actually is a decent insurance. We know that people, when they get Medicaid, mortality goes down. We know that children who go on Medicaid are able to go to school. They have less days out of school. We know kids who get dental insurance under Medicaid, again, less days out of school. There are always challenges anytime you have insurance. But at 3 o'clock in the morning, the first thing that anyone ever asks you is, what kind of insurance card do you have? And the fact is, we have an insurance-based system, and that's what we built upon.
More on the debate over Obamacare right after this. Dr. Amerling, you've said that Obamacare represents a threat to physician autonomy. What do you mean?
Well, the government clearly wants to control how medicine is not only financed but practiced. And what I mean by this is that they are enforcing standards of care. Now, you might think standards of care are really a good thing, but the truth is everybody's very different, and everybody requires individualized care, not standardized care. So the government is intent on compelling the practice of the standardized care according to what are called clinical practice guidelines, which are merely consensus statements of a group of so-called experts, many of whom, by the way, have very strong ties, financial ties, to the industries that are affected by their decisions in these panels. And we are being asked to prescribe according to guidelines in a one-size-fits-all fashion. And this is actually happening with the quality performance measurement system that is going on, payment for performance. That whole concept is actually centralized government control over physician practice.
And Dr. Benjamin, wouldn't that as a doctor concern you?
You know something, why would anyone want to pay for something that doesn't work? Why would anyone want to continue to provide care that isn't of high quality? We are in a profession, and that profession ensures that we work together and we share our experiences with others. Practice guidelines are advice for other clinicians based on the best evidence that we have. And it isn't driven by the kinds of devious things that many things that we hear every day. Is driven by a true goal and desire to give patients the best quality and pay for performance. Why would anyone simply continue to pay for doing stuff, again, that we know doesn't work or when you've had a problem? Paying for performance means that you pay for good outcomes. And you can do that in a way which protects physician decision-making. And that's what the Affordable Care Act is designed to do.
Dr. Amerling, do you think philosophically that we have a right to health?
No, you don't have a right to health care. And of course, you can be healthy or sick, and a lot of it depends on what lifestyle you choose to lead. But a right to health care implies that you are going to have to force a certain group of people, in this situation, doctors and other healthcare providers, to somehow deliver that right. It also obligates the government to provide access to that right through the federal treasury.
When someone becomes a doctor, don't they want to do that?
Yes.
When someone becomes a doctor, don't they want to do that? Don't they want to provide health? Isn't that the purpose of being a doctor?
Yeah, of course. You know, we're in the healthcare
Absolutely.
business. We're in the business of making sure that people are healthy. That's what the health equation is all about. That's why I went to medical school, so I can help people. And physicians aren't we're the center. We like to think we're the centerpiece of the world, but there are many other parts of the healthcare system. There are hospitals, there are pharmaceutical companies, there are people who provide physical therapy, there are non-physician healthcare providers. This is a comprehensive system, and we're all designed to improve our health of our population. We're not the healthiest nation, and we ought to be striving very hard to do that. So this ought to be about health. This not ought to be about protecting our personal prestige or anything like that. It ought to be making sure that we become the healthiest nation because we can do it.
Dr. Amerling, we're the richest nation. Why aren't we the healthiest?
Well, we have some very bad lifestyles, as you well know, and we have some extremely bad eating habits. People sit around a lot, much too much, and get fat, and they develop metabolic syndrome and type 2 diabetes and hypertension and cardiovascular disease. That's a major reason. We also abuse drugs, we abuse alcohol, we probably drive too fast or not well enough, and we get into a lot of accidents. So there are a lot of inputs into the health equation, so that input determines to a large extent the output of the healthcare system. That's why judging outcomes just based on raw numbers is never a good idea, and that's why the United States has this low rank in the World Health Organization's list, which is absurd. We're not 37th in the world by any stretch of the imagination. People come here from all over the world to get the excellent care that we provide. So we do try to provide the best quality care. That is not going to come through a standardized approach. It's going to come through individualized care where an individual physician sits down with a patient and in a relaxed manner in a consultation room tries to figure out, number one, what's wrong with them and how we can make them better.
And I would agree that it's about the physician-patient relationship, and I absolutely agree with the good doctor about that. But on the other hand, I also know that most of what makes us healthy occurs long before they go into the doctor's office. It's about walkable, greenable communities. It's about safe housing. It's about not being in an environment that is toxic. But having said that, when you get sick, there's no question this is the place to be in the United States. But having also said that, there are many, many things we can do to ensure that when we do get sick, that everybody has equal access to our health system.
Thank you both very much. We'll be calling on you again. Dr. Richard Amerling, Dr. Georges Benjamin, thank you both very much.
Thank you.
Thanks. Very welcome. Thank you guys for an important perspective. Coming up next, why are millennials abandoning Obama and his healthcare system? Hey, we'll be right back.